Cy Fisher. We're going to talk about cold and flu season, immune systems, kind of how to check in with your own immune system, understanding a little bit more about the immune system. It's really interesting as we look and we see that there are a lot of viruses, specifically influenza, that are diagnosed every year, right? Common cold, most of you have had, at least one cold a year. We're going to talk about how often we should have a common cold. And common cold isn't necessarily bad. Viruses aren't bad, they're in our environment all over the place. It is very prevalent, but having it too much can be an indication of some health issues. So we're going to talk about upper respiratory infections because that's the time of the year, what to look for, what it might mean with your immune system, if you need a little bit of help, what things are oftentimes missed from a traditional versus a functional medicine perspective like myself, and some of the options that we have to really support you as you go along here. Now, at the very end here, I forgot to put it on this page, but if you stay to the end, I'm going to give you at least 3 and maybe a few more tips for staying well over the holidays. So here we go. We'll jump right into it. So upper respiratory infections, they're very common. Common cold, influenza, they happen by viruses, but they also can be caused by different things. They can be caused by bacteria, fungi. Typically, the route or the duration, the total time that you have an upper respiratory infection is usually between a week and 2 weeks, right? You feel like crap for a couple of days. Maybe you got a little bit of a cough, runny nose, those sorts of things for the last few days. Maybe a fever in there. And so it's really important to kind of understand that this is a normal, common cold and flu symptom. Generally speaking, if you're a human being, you've had this process before. Oftentimes it doesn't feel well. Sometimes it's more intense. Sometimes it's less intense. Sometimes you barely feel it at all. There's a lot of things that go along with and that are not enjoyable in relation to immune system issues. So it's really interesting to learn about your immune system, right? There's a couple of different layers of your immune system. Some of it, this over this left-hand side, you can see the innate immunity. And what that means is those are the typical barriers that you have on the outside of your skin. For example, you have your skin tissue. It's called epithelial layers. On the inside of your body, you have your gut lining, right? And so there's a whole bunch of different cells. We won't go into the details of those cells, but those cells provide that boundary, that innate boundary that's there for you as part of being a human being. I like to think of it kind of like your house. At your house, you've got walls, and those walls protect things from coming inside. It protect intruders, protect rain, wind, most of the time rodents. And then you've got your adaptive immunity. The adaptive immunity is the part that adjusts, that changes, that gets to know and learn about what's happening and gives you kind of a long-term piece where they go in and they work directly with individual organisms or individual viruses or individual bacteria to provide safety for you as a human being. So they're very, very important. Now, over time, what happens is that immune system can be weakened. Maybe many of you have heard of the germ theory, right? So as small children, we're supposed to get exposed to the environment, the dirt, different things in our environment then provide us bacteria, viruses, fungi that our immune systems can start to learn from and grow from. But what happens is, well, some of the things that are happening right now are oftentimes our environment is a too clean of environment. What does that mean? That means if we live in too clean of an environment, then our immune systems do not get the opportunity to practice and understand how to work with the environment, how to work with some of these bugs and how to stay well. So it's an important piece to be able to be exposed as a kiddo to things like fermented foods, which have healthy bacteria, and playing in the dirt, those sorts of things. But as we age, as we continue to go throughout our lives, what oftentimes happens is there are different factors that have a tendency to degrade these barriers, these immune system qualities, right? So our environment is a big one, right? High psychological stress. So like at work or at home, or just the stress of the political environment, or the stress of being locked down and everything that was happening to us, right? Not getting enough sleep for varying reasons. The typical American diet, if you follow the actual food pyramid, yeah, you're probably going to have leaky gut. It's very much focused on kind of like a high simple carb perspective, and that has a tendency to really cause a lot of inflammation. All those processed foods, high oxidative foods, high sugary foods cause a lot of damage inside of your gut, that barrier, right? And so there's also things that happen too, like sinus infections that become chronic. You can't quite get rid of it. There's a whole bunch of reasons for that. But if you see here, I put things like food, processed food, sugars, stressors, sitting too much, gaming too much alcohol, too much of the consumption items that can blow out your blood sugar and dysregulate your physiology. And when all the parts and pieces and all the systems are dysregulated, then the barriers start to wear down as well. Now, this is an interesting picture. So this is a gut lining, and it's really important to understand that anytime there's a breach in the gut lining, it's a terrible thing, a terrible thing. That's why I purposefully had a picture that invoked almost like a gut-wrenching experience over here on this other side of the page, because when the barrier is breached, right, then that means that there's a whole bunch of dysfunctional and very unhealthy things that get through the barrier of the gut lining. And that causes a lot of disruption, and your immune system goes downhill, right? So leaky gut is the term. Now, traditional medicine doesn't necessarily look at it too terribly much, but it's something as research continues to grow on it, they're looking more and more. Now, as a natural health care practitioner, as a naturopathic doctor, we're taught about this stuff in school. And it's really important to understand that if you don't have, for example, if you've got a big hole in your roof, there's going to be water that comes through the roof. And if you don't want water coming in and damaging your house, it's really important to cover the roof in a healthy way that's going to last for a long time. So what happens here, you can see in this slide that when there's a hole, then stuff gets through. Well, the immune system attacks what comes through. Now, most of the time it's food, for example. Because if a food is not processed appropriately, then the immune system has to come in and process that. And if the immune system is trying to process foods, well, then it's distracted and it wears out over time, and there's not as much support to be able to protect you and protect those potential intruders, to protect you and keep that stuff out. So you get sick more often. So you can see over on the right-hand side, there's more inflammation in an unhealthy gut that has all these leaks, that has all these tears, that has all these things that are coming in and infecting it, and medications and stress and all kinds of different things really cause problems here. Immune deficiencies. And so another big one that I see sometimes is chronic sinusitis. Now, the typical idea here is that the immune system has protective barriers, right? So when you get mucousy, for example, when you're sick, it's not fun and it's gross to, spit up a bunch of sputum and green stuff, and it's nasty and whatever else. But that also is wonderful and beautiful because it's the protective barrier that provides safety for your body to be able to work against and protect you from that viral issue. Now, the problem is oftentimes the immune system gets overtaxed again, and you get some of these barriers break down, and or things kind of stay there. Like if all you've been doing is going to your traditional physician and getting an antibiotic, well, what happens is when you blow out the bacteria, then fungal infections then happen. Some women are probably familiar with this. When they get a UTI and they get an antibiotic, oftentimes they'll get a fungal infection afterwards, and that's not fun either. So it's really important to be able to address all of these deep-seated issues and protect and support the body. So how do you know if this is you, right? How do you know, how often do you get sick? You can ask yourself that question. Do you always get sick? Those are important questions. Do you have chronic congestion? Do you have the postnasal drip? Do you have chronic sinusitis? Right? How often are you getting those things? Is it quick? Are you quick to recover, or does it take forever? I remember when I was exhausted in med school, I got sick one time after winter finals, and it took me a month to recover. Now, I'm in a much healthier place now, and I am more conscious, and I work through a lot of that stuff now, but these are all questions to be asking yourself. Now, at the end, I'm also going to include a link to go and get the immune system checklist if you want to also do that. So stay tuned to the end for that particular piece of information. Again, traditional options include antibiotics, decongestants, cough suppressants, antihistamines, right? Um, Fever reducers, and those can be life-saving. They're very, very important. They can reduce pain and reduce stress, but oftentimes they're overused, abused, and not used in a very balanced way, and so they cause side effects. Now, we can use some of those things, but most of the time we use diet, stress, sleep, adjustments. We work on what's happening in your home. We support the immune system. We do diet and lifestyle and supplements on top of that, mental emotional work. There's a lot of different things that we do to really support you as a person, as a whole person, to be able to stabilize and support those gut barriers, to support those immune system barriers. So again, if you know anybody, this is probably a really common thing. If you miss a lot of school or miss a lot of work, you probably have a friend or a colleague or somebody that you know that this is their situation, right? Especially if you're doing like 3 or more cold or flu episodes per season. That's a lot of getting sick. And as we talked about before, the chronic congestion, the postnasal drip, often prescribed antibiotics. Again, that's what traditional medicine has to offer. They don't have a lot of tools above and beyond some of these small things to support, stabilize, and rebuild and restructure those barriers. It's like saying to a construction worker or um, a general contractor, "Hey, I got a hole in the side of my house. Can you just come put some plastic up on the side of my house," right? That's not going to be very effective. It's really important to be able to have the right tools to be able to help rebuild those things. So we're very specific here at Equilibrium Natural Health in the fact that our goal is to be able to help you identify specifically in the acute what you need support-wise, and then we really work on supporting you as an overall person. Working on the immune system takes time. There was time involved in the degradation of the immune system and the boundaries and the barriers that you have. And so it's really important to understand that in order to address some of those root causes, it's not just as simple as taking a drug to reduce your symptoms. You need to address, what's in your environment. What are you stressing about? How are you sleeping? Are you getting the foods that you need? Are you eating foods that are inflammatory? And so all these things are really, really important. And it's really important to understand I do not believe in a one-size-fits-all implementation program. This is a great place for me to describe how I treat patients, especially from a nutritional perspective. And many of you know this and are familiar with the way that I do this, but just for clarification purposes, I'm kind of the third method, right? So I believe that there's a third of the population that does really well on mostly and heavy emphasis on green vegetables, a third of the population that does mostly and or heavily focused on proteins, and then a third of the population that does really well right in the middle. And then there's some special exceptions to that rule. But everybody needs a customized individual diet based on their individual setup. I do a specialty urine and saliva test in my office that helps me identify that on top of and in conjunction with functional blood work and in a very long intake to tell me about a person, as well as in-office checking. I do an abdominal exam. We look in a person's mouth and their eyes. We do blood pressures and pulses. All these things really help us know individually about what's going on with an individual person. Because the idea here is the goal is to be able to address the root reason why you're having holes blown in the wall of your immune system, right? What are some life skills that you can acquire, we need to help you acquire, so you can better recognize when things are happening to yourself so that you can readjust, you can be empowered, you can take control of your life and understand what you need to change in order to be able to be a healthier self and have that healthier self-regulation that will then provide your immune system the capabilities and the necessary tools and building blocks to then expand and reestablish a healthy barrier so you can be healthy. Right? So we have a general immune foundations program that works on that supplement lifestyle intervention. We work with a person, we have resources, we do homework, we have follow-up appointments. I am doing some group webinar visits in the future and more of these visits online. So for those of you who have stayed here for the end, I want to share with you a few ways to stay healthy over the holidays. These are some of the things that I promised. And I did give you a few more than 3, and then I'm going to go see if I can get off of this and answer anyone's specific questions. But these are some of the ways to stay healthy over the holidays, right? So hydration is very important. We talked about inflammation. I love sharing with people the idea that if you have a fire, what is the first thing to think of in order to be able to put that fire out? And that is going to be to stay hydrated. And a good rough estimate is about half your body weight in ounces. Now, that's a hard goal to accomplish if that's not what you're used to doing. But I can guarantee you, I see a massive change in the patients that I work with who are able to utilize water as if it's a drug. If you need to think about water as a drug for you in order for your body to get well, think of it in that way because it really does make a huge difference. So you can be eating immune supportive foods, onions, garlic, oregano, mushrooms of varying kinds. There's a lot of supportive mushroom herbs. And then general herbs like echinacea, astragalus, licorice. Okay, those are good long term. You can take them completely and totally from the start of when it starts to get dark all the way to when it starts to get light in the summertime. Okay, and then there's some great acute herbal immune herbs as well. Oil of oregano, licorice is also a good one for short term. Thyme, right? Grapeseed extract, and many more. So another big component is to work on becoming aware of how much sugar you're actually consuming. The average adult needs to consume 25 or less grams of sugar a day, and if you'll take and you'll go and you'll look, you'll find that if you're drinking a pop or a juice or some sort of sugary goodie, you probably in one sitting you're probably eating as much sugar as a grown male adult should be eating in one session. So that doesn't do well with the long-term health of your immune system. That causes inflammation, which again goes through that whole process which we've talked about already. So rest is important. That is the time when we repair, and that is essential, right? Working on healthy boundaries is another big one that helps with the immune system. And some energetic modes of thinking that you probably have seen Tarzan when he beats on his chest. Ah, right. The thymus is underneath the chest right there where Tarzan is beating his chest. And in some energetic modes of thinking, that is where your power comes from. So that's related to your immune system because your thymus is a big part of your immune system. So in order for you to keep your power, it's very important for you to be able to have healthy boundaries with people that you love, with people that you work with friends, because that additional stress can affect and reduce your immune system. So, which leads me to my next piece, which is things like stress management, including things like journaling and meditation. A lot of people nowadays really have a hard time with meditation. One of the things I'm currently endeavoring myself is 15 minutes a day of sitting in quiet solitude. If you need to, you can go sit and close a closet door and sit in the dark for 15 minutes and do nothing but go inside and listen to yourself. That's really, really important. Castor oil is another really great one you can use acutely. Hydrotherapy, hot and cold showers ending on cold, supportive nutrient foods, dense foods like bone broth, and make sure you're doing it warm if you're sick. Warming foods for fall are really important, things like soups and stews, and then simple nutritional things, which you've probably heard of with the pandemic. Zinc, vitamin C, vitamin D, those are things you can use anytime you need to support the immune system. Quercetin and NAC specifically are for particular viral issues that we've had recently. Also, again, becoming aware of how much processed foods you're consuming, avoiding alcohol, eating a whole foods diet, and understanding where your food's actually coming from, understand how processed your foods are. Again, going back to that regular social connections, there's some research that shows that people will live longer and healthier if they have regular social connection. And people who do not have regular social connection die on average 10 to 15 years earlier and in miserable condition. So that's a really good one to be able to check with yourself, because social connection can be difficult. It does require a lot of work and effort. So this is work, people. This is work. In order to be able to really make this happen, it does require a fair amount of work. So it's important to be able to understand and work with in integrating logic and emotion into your relationships as well. And we talked about the 15-minute meditation. So the next piece is to understand that there are a lot of different things that if you need some additional support above and beyond what we've talked about today, I do have an immune assessment quiz. And let's see if I have it in here, just like this. So I have a download for you. I'll go ahead and I'm going to have to jump off here or jump on another page and copy the page, and I'll put it in the questionnaire and or I'll put it on the page. If you want to go ahead and download the immune assessment quiz for yourself, you can check and see where you're at. Check your immune status. If you need additional support, please give us a call or jump on our website. We have an online intake where you can ask some additional questions. You can also join our Facebook group, and we love when people come and check out our Facebook or our YouTube videos. I try and